Good morning. I'm Congresswoman Suzan DelBene from Washington's 1st Congressional District, and I want to thank Congressman Kilmer for being here, Congressman Kilmer for joining us, Governor Inslee, and County Executive Constantine for joining us today. We came together to talk about how important funding is to support the efforts happening across our communities to both contain and respond to the coronavirus outbreak. We also have important new information about events happening at the Life Care Center in Kirkland, which is part of my district and also part of King County. And so we're going to keep our comments a little shorter here on funding, and we're happy to answer questions about that later, so we can also focus with more details on what is happening at Life Care Center. I cannot underscore how important resources are to this effort. I want to thank all of our first responders, the public health officials who have really been at the forefront of fighting this outbreak and working with our communities. They have been doing yeoman's work. Our condolences go out to all of the families who have lost loved ones, who have loved ones who are currently ill and fighting this disease. There is a great coming together of federal, state, and local resources on this effort. But it's been expensive. In Snohomish County, which had the first case of coronavirus, they spent $200,000 just to manage that case and the patients, or the folks who came into contact with that patient. King County is spending approximately $100,000 a day, and that number has been probably going. The state's costs are over $2.5 million. And so it's been a great strain on state and local governments. It has been a top priority for me that we make sure not only we have dollars to help state and local government going forward, but that we can backfill the dollars that they have spent. As many of you know, the president signed this morning the supplemental funding package of $8.3 billion in emergency spending. In there is $2.2 billion focused at supporting state and local governments' public health efforts. And we know that $11.5 million there will be coming to Washington State directly to help support public health. That is the first wave. There are over $950 million as part of that package, which will go on an ongoing basis to also help continue to support efforts across the country. And this is a beginning. Congressman Kilmer serves on the Appropriations Committee and has been critically important to spearheading this effort. In particular, has focused on making sure we have resources to help our small businesses that have been economically impacted. And so let me turn it over to Congressman Kilmer.
Thanks. I want to start off echoing Congresswoman DelBene's condolences to the family and friends and loved ones of those who've lost their lives through this. And I also want to thank the incredible first responders and the healthcare workers who are treating patients, our state and local partners who are working to coordinate the response here in King County and throughout the state of Washington. And I want to thank Governor Inslee and his team and Executive Constantine and Representative DelBene for their leadership and their partnership as we address this. There are clear needs on the ground, and this week Congress passed a $8.3 billion emergency funding package, which is an important first step in ensuring that the federal government steps up to the scale and seriousness of this growing public health challenge. This bill, and I want to break down some of the specifics for you. This bill includes $2.2 billion in public health funding for prevention, preparedness, and response, including $950 million to support state and local health agencies. Half of that is to be allocated within 30 days directly to states and local governments and to tribal governments, and can be used for everything from surveillance for coronavirus, lab testing to detect positive cases, contact tracing to identify additional positive cases, infection control to hopefully prevent new cases, and other public health preparedness. There's $300 million for the Infectious Disease Rapid Response Fund, which supports immediate response during outbreaks. To Congresswoman DelBene's point, the supplemental includes a general provision to reimburse state and local governments for costs that they've incurred since the beginning of this outbreak, and to allow funds to be used for facilities to improve preparedness and response. There's nearly $1 billion for medical supplies and healthcare preparedness and medical surge capacity, and about half of that is for procurement of pharmaceuticals and masks and personal protective equipment, which can be distributed to state and local governments that are dealing with shortages. There's also some funding for training for health professionals to ensure that they're adequately avoiding the spread of this. More than $3 billion in the funding package that passed is for research and development, for vaccines and therapeutics and diagnostics. And importantly, once those vaccines are developed, the bill provides more than $300 million to ensure access to affordable vaccines. I want to mention one other quick thing before I turn it over to the governor, and that is, as this has played out over the last few weeks, we've already begun to hear from employers throughout the state of Washington that are feeling the negative economic impacts of this. Our shellfish growers who export predominantly to China, where the ports are largely shut down, manufacturers, and even just Main Street businesses who have reached out to us and have explained that they're taking a hit. I've been able, as a member of the Appropriations Committee, to take that concern directly to our House leadership, including our Speaker of the House and our Appropriations Chair, Nita Lowey, and we pushed for assistance for our employers and our workers that are in affected communities. And as a result, the bill that was just signed into law today enables the Small Business Administration to provide an additional $7 billion in loans to small businesses across our region and across the country that are suffering financial losses as a result of this outbreak. There are already disaster loan programs as part of the SBA. Those are generally targeted at things like hurricanes and tornadoes. We know that this has a significant impact to our economy, not unlike those disasters. And so it's important for the federal government to stand up not just to the public health challenge, but to the economic challenge as well. And my sense is there will be more to come in that regard. And happy to talk about that further. But let me move on with gratitude for the governor's leadership on this, and let me pass the mic over to him to talk about some of the work that the state's doing to step up.
Thanks, Jerry. Thank you. We are pleased that the U.S. Congress is sending Washington State much more than their thoughts and prayers, and that's the resources that we so need to make this a much more robust effort. And I just want to thank our delegation. They've been super on this, and I think this has been a good success for all concerned in that regard. I just want to give you a briefing on our state efforts. We are passing an appropriation of $100 million to help in a whole variety of these efforts that we've alluded to today, an additional appropriation of $25 million that presumed federal dollars, and I feel good that that will be forthcoming. I joked yesterday about the prioritization of the federal money and the need for Washington State, but I do believe that we have a very clear understanding that we are the tip of the spear nationally on this. We need to have the priority be Washington State at the moment because we are the tip of that effort, and the rest of the country, frankly, is looking to us for leadership on how we handle this crisis. So I'm glad that the legislature has also stepped up in this regard. I'm also glad that we have been able to do some things to help individual families that are economically dislocated by this. As you know, we talked yesterday about the opening up our workers' compensation to the first responders and the healthcare workers, and I want to tell you, these are courageous people. They're working long hours right now. We've had many people have to be in quarantine. I'm glad that we've opened up workers' comp abilities in that regard. We also are looking at some unemployment insurance flexibility to be able to help families who are undergoing problems. I talked to the Vice President about this. We need some federal flexibility to be given to us, but I hope we're successful in that regard. I'm very pleased that pursuant to my emergency order, the insurance commissioner has essentially said that we won't have co-pays associated with this. That's a good statement. We also, I made a decision yesterday, the state will be paying the testing for the test for anyone who does not have insurance in the state of Washington. We hope to help families in that regard. The other things we talked about, I've just mentioned them briefly. I talked about them yesterday, the Vice President. I think we made headway yesterday with the administration on increasing our stocks and replenishing our stockpile. We have a stockpile. We've been sending thousands of personal protection devices and other medical equipment out that is now being replenished by the federal stockpile. We need that stockpile to be replenished for some things, including ventilators in the long term, but I think the federal government is well aware of our needs in this regard. I want to note, we know that we have real concerns about long-term care facilities, and we are standing up an incident command specifically dedicated to assisting long-term care facilities. We know that the first potential victims of this virus are our elderly and those who are medically compromised. So we are standing up a separate incident command post in the structure to specifically be of assistance to long-term care facilities, both to help them prevent infection from entering the facilities and to help them deal with in the event that happens. So we'll look forward to that assisting in this regard. And with that, I think I'm introducing Dow. Dow, thank you very much for your leadership.
Thank you, Governor.
Thank you, Governor. I want to speak primarily about the Life Care Center, but I want to start by thanking our members of Congress. This funding package is going to be absolutely critical. Our folks tell me that King County alone will spend some $50 million just in the short term on dealing with this public health crisis. And both the state legislature and Congress are to be commended for stepping up and appreciating the gravity of the situation. I want to begin by, again, expressing my condolences and the condolences of the people of King County to those who've lost loved ones and our support for those who are convalescing or recovering from COVID-19. The health and safety of all of our residents, but particularly those residents of the Life Care Center in Kirkland today, are our highest priorities. All of those involved in this effort, from nurses on the front line to public health officials and our public health staff at the State Department of Health, at King County Public Health, at the Centers for Disease Control. All of those crafting and implementing new policies and procedures are marshaling every ounce of our resources to fight this outbreak. Here are the numbers as I understand them from this morning. There are 69 residents at Life Care Center. 15 have been transported over the last 24 hours to hospitals, those in need of hospital care. Among the agencies that are on the ground and working there are the Centers for Disease Control, the State Department of Health, and other state agencies, the City of Kirkland, King County Public Health, King County Emergency Management, and of course, the Life Care Corporation itself. I've collected as much information as I can from among these sources. Now, as a reminder, Life Care residents need 24-hour skilled nursing care. They are there because they require the high level of care that's provided by this kind of a facility. And each individual has a unique health profile as well as a unique family support network. At this moment, the situation is extremely fluid, but this is what we know. All residents and staff of Life Care are either being tested, that is to say they've got tests back, or they've provided samples that are being tested, or they will be tested shortly thanks to the University of Washington's increased testing capacity that's coming online. We've been waiting for an increase of testing capacity in our community. It has been a tremendous strain for public health to have to triage those tests. Now we're going to have enough tests to make sure everyone there is tested and to make sure that others, healthcare professionals who are working throughout the community, are tested. All residents who need to be hospitalized have been or are in the process of being transported to a hospital. If someone's condition worsens, they will also be transported. I'll remind you that if someone is infected with COVID-19, not only do they need to go to a hospital that is adequate for treating all of their underlying medical conditions, but also one where they are not going to be in a position to infect others. And some of our hospitals are having to change their procedures or the mechanics of their facilities in order to accomplish that. If family members want to take their loved one home, and some family members of those at Life Care have expressed that, we are working with the state to set up a system with an expert to help them that will provide the support they need to be able to do that. As I say, many of these residents have medical conditions that would not allow them under any circumstance to be able to be cared for in a home. But Some of them are able to go home if we're providing them enough equipment and support. So we're working with the state of Washington to make that possible. With the assistance of the state and the Centers for Disease Control and Prevention, new protocols and equipment, Public Health believes that the facility has significantly improved. We've gotten good reviews from physicians from outside who've come in and seen the care that's taking place at Life Care right now, and I want to commend those medical professionals who are on the ground at Life Care working under very adverse conditions. And that this is, for many of the residents, the best place that they can be, those who are asymptomatic but have these health conditions that have to be attended to in a 24-hour care facility. Some observers have wondered why the facility hasn't simply been shut down and evacuated. Well, beyond the reason I just explained, that it provides this unique care that many of them need, there's also no capacity at hospitals or nursing homes to take them. So the governor mentioned this, and I really want to emphasize it. In addition to the resources already at the Life Care Center, a health and medical task force, or the governor did not mention that, he mentioned that we're setting up with the state EOC an incident command structure, rather, to oversee nursing home staffing, family-based care, personal protection equipment distribution, and communication with families, among other needs. So the state of Washington has, within emergency management, incident command centers. They're subject matter based, and today the governor has agreed to set up one that covers nursing homes. So it would focus on Life Care and any other nursing home where there was an outbreak. They're able to come in with an expert team, provide the work directly with the staff to make sure they have appropriate staffing levels, with the families to make sure they have the adequate equipment and supplies. This is very important. Local public health agency, even a big and robust one like King County's, if there's a hot spot here and then one there and then one there, people's attention is being appropriately drawn to those and away from the community-wide public health work we need to be doing to keep everyone safe across a population of 2.25 million people. So the state's role in really taking on these hot spots and helping us to make sure they're adequately resourced and staffed is tremendously important and very much appreciated. Now, what I was getting to before is the federal government is stepping up through the budget, but also, very importantly, through a task force of 30 medical professionals who are going to be landing on the ground tomorrow to go to the Life Care Center and to help provide the service that a very strained staff there very much needs. That's from the United States Public Health Service. And we are grateful that the cavalry is arriving. It is going to make really rapid change, I think, in the conditions there. The state and the county are working with families to tailor solutions that will work for each of them, and none of us could help but be moved by the very real plight of those who are having trouble communicating through Life Care with their relatives who are in the facility, who are wondering about their condition, who are asking whether they need to be moved to a hospital or whether they can come home with them. That challenge is going to be met, and we are not going to allow that kind of situation to occur as we put these other federal and state resources in place occur in the future. I'm going to be talking with the state and other providers and others across the nation about how we address this issue moving forward. And it will be key to slowing the spread of the virus and keeping people, particularly those in vulnerable populations, healthy. For the families who say they are not being adequately communicated with, we hear you. With this state and federal help, and I hope with the continuing cooperation of the Life Care Corporation out of Tennessee, we want to change that. We want to make sure everyone has the information they need and the support they need in this time of crisis. But know this, these families are top of mind. These residents are top of mind. We are 100% committed to the health and welfare of your loved ones. We must prepare this region for the inevitable continued spread of this virus, at least in the short run. But we will do everything we can to slow its spread, to protect those who are most likely to become seriously ill from it, and to keep the entire community safe and fully informed. I would be happy to take your questions.
Constantine, Dr. Duchin was telling us Wednesday, where it was that there's a paradoxical effect. If you close schools, you can actually increase the spread.
So I'm going to let Patty Hayes, who's the Director of Public Health in Seattle-King County, speak to that. From what I understand, the University of Washington is closed today. Is that correct? They're not having classes? Yes. Virtual. That's how I went to college too. Yes. But the fact is that there are pluses and minuses to closing school, and I think Patty can speak a little bit more to that.
Thank you. I want to thank all the partners for their incredible support, and my personal condolences to families, and also to all the caregivers and first responders to stand together as we address this crisis, learn together, and mutually support one another. In terms of schools, our guidance has not changed. We believe, because of a number of factors that CDC is helping us look at, that it is not warranted to close a school unless there has been a COVID-19 case in that school, and then we are working individually with that administration on what needs to be done. So the reason why that's the guidance still is, number one, children within this outbreak seem to not, we do not know how they play into the transmissibility of COVID-19. That's something CDC and our best scientists are trying to help us figure out. It's a little counterintuitive to what we know from other infections, but it's a reality, and I need the public to know that, because there's lots of questions about children in schools. Secondly, we know that when we close a school, children have to go somewhere. So if you think about families, where often are the caregivers? It might be grandma, grandpa, an elderly member of the family, the exact people that we're concerned about. So sometimes keeping children in the classroom and under the supervision of the school is the best advice. And then if they are symptomatic, we certainly work immediately with that school and the structure that they have for the school nurse and healthcare identification. Thirdly, in our past experience, children will go and congregate somewhere else. So it's not like we're avoiding a congregation of children. They'll go to the mall. I know many of us have done that in our younger years when school was out. Or children go to the parks together or whatever. So please don't think that closing a school is the answer to prevent children from congregating. So we're working dynamically on this. Our guidance may change, but right now we're using the best science, and that's what we're committed to do, to make these decisions ongoing. So please stay tuned. We will obviously keep you lifetime updated on that.
Executive Constantine, it has been 6 days for the folks at Life Care. Why hasn't King County Public Health, state public health, been in contact with those families? Why does it take 6 days to call the cavalry?
Yeah, I'm going to let Patty speak to what's been going on the ground. As I see these reports, and some of them I actually learned about through you, I personally emotionally impacted by this. This is agonizing, putting yourself in the position of being one of these family members, standing outside while your parent is inside and you can't communicate with them. I'm going to go ahead and say, if you don't, that we have to rely on Life Care to be the intermediary in communicating with these folks. And we've had some challenges with Life Care, and I'm starting to lose my patience. But we want to continue to work with them because they're an absolutely critical part of this picture in helping to provide the appropriate care for these residents and for their families. Go ahead.
So some of the details around, we have had staff on the ground to take a look at the health and welfare of the residents there, the staffing patterns that need to be done, while we're also aware that it is a responsibility of Life Care to be communicating with the family members. They are the ones that know the family members. We have not been able to get lists. We opened up a call line specifically for families. But I've got to say that a personal contact from Life Care, where you are actually communicating directly with the family and talking about their concerns, talking about that, while public health works with them to give the public health message around the care of the family, it has to be done together. And there's been a breakdown here. Families are not interested in just calling public health and talking on our call line. They want to hear directly from Life Care about what's going on, the status of the patient there. Remember that these facilities are skilled nursing, so they're under HIPAA protection. The family needs to talk directly. Public health cannot all of a sudden become a conduit to talk about the status of a family member that's in there. That's a responsibility of the healthcare providers to provide the families under the federal protection of HIPAA, confidentiality, that communication. I've been extremely frustrated about this. And we, as I said, have set up a call center. That's not sufficient. So we are working, and I was on the phone this morning with Healthcare Authority and with Department of Health, who's in contact with the Department of Social and Health Services, about setting up this incident command so that the right authority at the state can communicate with these nursing homes about what are appropriate expectations and protocols for communicating with the people they need to. And while I'm answering that question, I do want to read you, we brought in an outside medical professional, Dr. Stephen Morris from the University of Washington. We wanted somebody who hadn't been in the facility to walk in there and do an assessment. And I have his permission to read this statement. My general impression of the facility was that it is an outstanding long and short-term care facility at its baseline and well-functioning. It was immaculate. It appeared to be well-staffed, and the clinical and support staff appeared to be working as one would expect for such a facility at the time of day, and he was there late. It wasn't day shift. They greeted me warmly and were helpful in the patient evaluations. It was clear that there were some signs of stress on the facility, evidenced by multiple meetings and a just-in-time training taking place. That's his reference to the hygiene measures and the PPE, the personal protective gear that we're doing. What appeared to be an active emergency operations center had been set up there, and an abundance of what to be management staff present. All patients evaluated appeared to be well cared for. Let me repeat that. All patients evaluated appeared to be well cared for. I have no evidence or concern that the standard of care was problematic. Given that my clearly positive impression of the facility was garnered during a crisis is commendable. I wanted the media to know this because I know that families are very concerned, and so we deployed someone as a separate expert to go in there last night as we're in the middle of assessing each patient, transferring the ones that needed to go to the hospital, stabilizing those that are not symptomatic, separating those that have symptoms so that we're attempting to prevent that cross, and doing an all-facility testing. So all of that is in motion, and we will continue to work on that.
Thank you.
I've spoken to multiple families this week who have loved ones at Life Care who've passed away. They didn't have symptoms before the virus, so they weren't tested before. Everyone understands that protocol. But will those bodies be tested?
No. That's a very good question. And yes, the medical examiner's office has been working in concert with CDC. They're identifying the deceased that are related to COVID-19. Again, now that the testing protocol is open and we have more testing sites, testing availability, we are doing that and we are identifying it. And when you get the update numbers every day from us, that does include the tests that we're doing on the family members that have died.
Why isn't the medical examiner's office releasing the names of those who are deceased because of COVID-19? Routinely, the medical examiner's office does release names.
Yeah, that's a good question, and actually I'd have to talk to the MEO about that. This is such a huge wave right now we're having, and staff is working so fast. I'm not quite sure, but I'll check on that and we can get back to you.
You said that 15 residents were moved to the hospital. Which hospital, and how many are left?
That's great. That's great. So, yeah, so the folks, so what we're doing with the regional network, the regional command that is works with all hospitals and facilities, is we've done a lifetime assessment of hospital area readiness. So because we knew that Kirkland was getting up to capacity, we have been assessing where we needed to go. I actually talked last evening with the public health director in Snohomish County and Pierce County in case we needed to use some of their hospital assets. I haven't received a report this morning on where all these individuals went that we transferred, the 15 we talked about earlier. But we're having to disperse them to hospitals. As Executive Constantine said, we assess each of these individuals and their care needs. They need to go to the hospital that has the right type of facility. Many of these hospitals are stepping up and converting more of their units so that the negative airflow that we need to protect both the staff and the patient. And so as we do that, that's going to be live time as the hospitals work with this. So we'll be getting that information. I'm not quite sure when. We're happy to share it when we have it. And again, the number that's left within life care right now is 69.
For people who have come into contact with people who have confirmed cases of the virus, but they themselves are not showing symptoms, the county has issued guidelines, advice for what those people should be doing, including not going to work or school for 14 days. What is the county doing, though, to monitor those people to make sure they're adhering to that guideline? How are you ensuring that they're following this sort of self-quarantine guidance? Yeah,
that's a great question. As this outbreak increases, what I'll say to you is that it'll become more and more difficult to individually monitor everyone. We ask people actually to check in with us once a day. When people are in quarantine, we want them to talk with us if they're feeling symptomatic so that we can help get them to their healthcare provider. And what we have found over time, and again, this is to date, and as this escalates, it's more and more important for people to take that personal responsibility, and my staff works to support these people in following through themselves. We do those calls with them, and they check in with us. We're looking at setting up ways to do like Skype work with them if we need to do temperature checks lifetime when we decide that. That's not decided right now. So we're working dynamically on what the protocol is. But we're not going to be forcing somebody to call us. We're relying on, and most people, we've had so much great compliance. I mean, this is scary for everybody. They are happy to have public health working with them and helping them through each day on how they're feeling. Because I've got to say, if you were that person and you were asked to quarantine yourself for 2 weeks, you can imagine how stressful just rearranging your life is around that. You need to know that you've got an anchor in public health that if you've got a question, you do, and we prioritize talking with those folks.
About how many people are you having those sorts of communications with now?
Gosh, you know, I know that we're monitoring, I'm going to give you a range. It's a huge number. It's like 300 to 500 people. It's large. And so it really stresses our staff. That's why we're bringing in more staff. That's why the federal funding is so important so that I can staff up to meet this. I want everybody to be feeling like public health is here for them. It's very important to me.
Your first responders have also been stressed. I know.
Oh, just terribly
there was a
stressed.
quarter of the firefighters
Yeah.
who were in quarantine.
Yes.
12 of them were being tested.
Yeah.
Do you know how they're doing?
Yeah, so the great news about the quarantine firefighters is, again, they were prioritized for testing. We have a great, incredible EMS system, top in the world here in King County. We are so fortunate. And because of the way the state has organized the EMS system, Then we coordinate with every fire department around the county. Our asset moving on the east side, we have been supporting that so that they're not at risk of not being able to respond. And then each area commander has been working individually. This is the stellar employer example I want to give you. Those area commanders, they check in with those personnel every day. They're checking in how they are, how their symptoms are, how are their families. That's what I want from employers. And as we get results, we are obviously giving it to the commander and the individual, and those personnel are either coming back online, and my understanding is that it's real time. We're working through this. I don't have a positive, negative test specifically on those guys, but it's guys and women. But it's been incredible and very supportive environment. We've deployed Dr. Ray, who is our EMS medical director, to work with every fire department. He met at length with the whole region on the east side and continues to be in daily contact with all of them.
Anybody have one last question?
I have another question about life care. It seems, I hear your frustrations with the communication, and I'm not sure if you're aware, but the communication's coming from headquarters in Tennessee. And in one instance, we spoke to a woman who found out her mother was dead at 3:30 in the morning. About 8 to 9 hours later, the headquarters in Tennessee called her to tell her mother had no symptoms and she was doing just fine, and they would keep checking on her. Is there no oversight, and is there not anything,
Yes.
or will you be doing something to take over at some point if this continues?
So I didn't know that, and this again is why I am glad that this morning I was on the phone with the state. I want to thank the governor's staff. He's got incredible agency directors, and the Medicaid director is fantastic. She took my call at the wee early mornings this morning, and we need to know when those things are happening, because it is the state that then can begin to help work directly with those, whether or not it's Life Care or any other employer on that. I apologize that happened. That is not. The state needs to help us sort that out. That shouldn't have happened.
If I could just, yes, I just wanted to, again, remind you of what we've heard. The communication is a challenge. The care being provided by professionals on the ground who are under tremendous strain is actually excellent. And so we want to make sure that we fix the thing that's problematic, but that we respect and support the thing that's working. And I think that the federal team that's coming in is going to be able to help us with that. Thank you all for being here, and our health professionals will be available to answer your more specific questions. Thank you.